Thank you so much. And to me, I've been at the intersection of education and employment again for 12 years. Uh, and almost all of that has been in demand-led initiatives, right? How do you get, and I think many academic institutions respond to that. But Mike, even if it's like the number one topic at ASHP, you don't always have people kind of engaging in these workforce issues. You may have, sometimes you are in talking about curriculum, sometimes you have like light engagement with a workforce board or a chamber of commerce or something like that, and those are all really good institutions. But tell me about when you were trying to solve this problem yourself and were finding that you couldn't sort of figure out how to solve it yourself. Where does bringing in a third party and a third party education and infrastructure on that train to hire, where do you get leverage out of that?
So I think, as I look back to see what has been done in this space over some time, and places have it established, and some health systems have a full training module. They have everything that meets the ASHP requirements. Unfortunately, it's very resource intensive. And so part of it is, do you have the people that can do it? And a lot of times it's people that are doing it on top of their, 40-hour work week. That's just not sustainable for long term. If someone leaves, then you have to wait to hire someone back. And that really was the biggest gap for us, looking at how do we solve this problem. And so looking externally for third parties, there's a few that are out there. But I feel like when it came to talking with Cengage, it really was an opportunity for us to say, how do we reimagine this? And I think that level of partnership that you guys offered to us was something where we said, all right, we can put our own fingerprints all over this, make it very Novant centric, but also have it be so that our team members get all of the education that they need. And so I think I've mentioned it before, having someone handle the didactic training was key for us. That level of building out the coursework and making sure that you dot all your I's and cross all your T's and make sure everyone is prepared is a lot of work. And we have an education team, but that education team here is not equipped to be able to update changes when there's new regulations, to update different things that come out. And when you have national partners like ASHP that, set the curriculum and set the standards for what our technicians need to be, then, the PTCB, which is the Pharmacy Technician Certification Board, they may make changes. And if we didn't buy the new book, we're not training to the right standard. And so we want to make sure that our team members that are going through the process are able to have everything that they need so that when they sit down to take that certification exam, they're prepared and able to do it. And I think with the partnership, while they're getting that, we can also not only do two things. We can teach them how to be a technician, which is where Cengage comes in the didactic work, but they also can teach them how to be a technician at Novant Health. And melding those two things together really has set us up for success in getting those team members into that career ladder that we spoke about earlier.